First of all, let me start with my moral responsibility working within the health system. I think we can reduce the cost of it considerably. So that would go some way to doing it. Secondly, some of the decisions are heavily political, and I'm not sure that we've shown that we're able to resolve those. We've got far too many hospitals, if you like. We haven't built up systems which are terribly efficient, and we can do more to rationalise the quality of the service and deliver a higher quality. On the other hand, the decision about austerity or not, long-term investment, servicing debt, are above my pay grade, I have to say. I take the view, as you've probably gathered, that I'm not convinced that there's been any evidence that austerity has ever worked anywhere, and that we need to find different models for investment over a period of time for services that we want. But as a population, we have to make elections which essentially we're going to be choosing between governments which opt for a more private sector involvement and those which don't. And I think we're going to have much clearer arguments than we've had for a long time about the benefits or otherwise of those. Because I think it's quite clear that in the United States, a private system is failing because it's transactionally based and costing too much. On the other hand, some of the insurance-mediated systems that occur in parts of Australia or in parts of Europe seem to be moderately successful. But they are gatekeeping what people are allowed to receive. And I don't know if the more we understand about what these companies and these are doing in order to restrict access to healthcare, the less comfortable I feel about it.